Any mutation in the DNA of prostate gland cells can cause abnormal cell production, which leads to prostate cancer. These might be confined to the prostate gland or move to other organs, such as lymph nodes, bones, liver, and others. It occurs in 4 stages, from localized to advanced. The leading cause is a mutation that occurs in the gene, but some factors can influence its occurrence, including age, weight, family, and gender. Loss of weight, loss of appetite, blood in urine, and dull pain in the pelvic area are some signs that a prostate cancer-affected person feels. A prostate-specific antigen blood test is used to find the presence of cancer in the prostate gland. A Gleason score reveals the aggressiveness of this cancer. Let's explore this video to find the diagnosis procedure as well as its treatment process. What is meant by prostate cancer? A disease in which cancerous cells are developed in the prostate gland. The prostate is a small walnut-shaped structure just below the bladder and in front of the rectum in males. The function of this gland is to produce a fluid to grow and transfer the sperm. It's one of the most common cancers in males. Many prostate glands remain in the prostate and cannot cause harm where they need no treatment. On the other side, some prostate cancers grow gradually and need some therapy. Some types are aggressive too. Prostate cancer is the second most common cancer in men after skin cancer. It's gender-specific only in men and in AMAB people. A report by the Centers for Disease Control and Prevention reveals that 13 out of 100 people could develop prostate cancer in the United States, and almost 34,000 people usually die due to prostate cancer. What is meant by early-stage prostate cancer? The very first stage of prostate cancer is localized, and cancer stays in the prostate and not over to other parts of the body. When these cancer cells move to another part of the body, it is known as advanced prostate cancer. There exist a total of 4 stages of prostate cancer. At stages 1 and 2, cancer does not spread and is known as the early or localized stage. In stage 3, the cancer spreads to the nearest tissues, and it is known as locally advanced prostate cancer. Stage 4 is known as advanced prostate cancer. In this stage, the cancer spreads to other parts like lymph nodes, bones, liver, or lungs. Types of prostate cancer. The most common type of prostate cancer is adenocarcinoma. This starts in the cells of the prostate and is confined there. This gland secretes a fluid, which is the part of semen. Other less common types include small cell carcinoma, transitional cell carcinomas, sarcomas, and neuroendocrine tumors. Neuroendocrine tumors are a scarce cancer type. In this condition, a group of uncommon tumors start in the neuroendocrine system. They are linked to the endocrine system, which manages the hormonal system. As neuroendocrine cells are divided throughout the body, this tumor affects many body organs, such as the liver, which occupies 30% of the neuroendocrine tumor, and the pancreas experiences 7% of the neuroendocrine tumor. Causes of prostate cancer. The exact cause of prostate cancer is still unknown. It develops when any change occurs in the DNA of prostate cells. As we know, a cell's DNA contains instructions for the function of that particular cell. So, mutated DNA may not develop the proper function of cell formation and disease processes. Therefore, extra cells start building, further known as tumors, which can cause cancer in the affected region. These abnormal cells sometimes transfer to other body parts out to the prostate gland. Let's discuss some risk factors that can increase the chance of getting prostate cancer. Risk factors of prostate cancer. Age. Men cells' DNA over the age of 55 has more chance of producing mutations in the prostate gland. Weight. At age 50, obesity could lead to an increased chance of prostate cancer. Family history. A person whose grandfather, father, or brother is having this cancer has more chance of getting it. Genetics. If someone has Lynch syndrome, he has a more significant risk of prostate cancer. What are the symptoms of prostate cancer? At an early stage, prostate cancer does not show any specific symptoms, but after time, when the disease progresses, some symptoms may be examined by the patient. These symptoms include dysuria, a condition in which burning or pain occurs during peeing, stop or weak urination, urinary incontinence. It is a condition in which the body loses control of the bladder. Fecal incontinence. It is a condition in which the body loses control of its bowels. Erectile dysfunction. It is the inability of an individual to get a long enough erection during sexual intercourse. Pain in hip, lower back, and chest areas. Loss of weight, loss of appetite, blood in urine, and dull pain in the pelvic area are some signs of prostate cancer. How is prostate cancer diagnosed? To check the signs of prostate cancer, the healthcare provider first takes some screening tests. The first test is a rectal examination, in which the healthcare provider enters a gloved lubricant finger inside the rectum and examines the prostate gland. If it seems complicated, it would be cancer. Blood test. The prostate gland makes a protein known as prostate-specific antigen. A test is used to know its level. If its level is high, it might indicate cancer. Diagnosis includes further testing, which would be imaging a biopsy. An MRI or ultrasound can show a whole picture of the gland, including the cancerous area. Based on the radiography diagnostics, the doctor decides to take further steps to determine whether to perform a biopsy. He got an idea about the situation of the prostate gland. In a biopsy test, a small tissue sample is taken from the gland and diagnosed to determine the extent of the cancer. The mutated cancer cells are dangerous and are most likely to be treated. How do you know the aggressiveness of prostate cancer? When a biopsy confirms the presence of cancer, then the next step is to evaluate the level of its aggressiveness. In this case, the doctor will take a sample of the cancer cells to understand the difference between a healthy and a cancerous cell. The Gleason score will scale it. A Gleason score is used to determine the aggressiveness of cancerous cells. Gleason's score range is in two numbers, 2 and 10. These scores are usually used to access prostate biopsy. For example, if the results of the biopsy range from 6 to 10, 6 will indicate low-grade prostate cancer, 7 will reveal medium-grade prostate cancer, and grade 10 will indicate a high-grade prostate cancer. Further testing includes a genomic test. It will reveal the mutated gene. This will give information about the prognosis, but it's not necessary and is not used for any prostate cancer patient. How is prostate cancer treated? If the Gleason score indicates low-grade prostate cancer, then there is no need for treatment. However, after diagnosis, doctors sometimes perform active surveillance. In this case, regular blood tests, rectal exams, and biopsies are performed to look after the progress of the cancer. At the stage when it indicates that cancer is continuous and does not go away, treatment is recommended, either surgery or radiation. Surgery, an option to remove the prostate gland and its surrounding tissues. Remember, it's only done for those cancer patients whose cancer is confined to the prostate gland. In radiation therapy, high-powered energy is used to kill cancer cells. This may use an external beam of radiation outside the body, such as an X-ray or protons. In some cases, radiation is placed inside the body, in which a radioactive source is placed inside the prostate tissue. Sometimes, this radiation contains rice-sized radioactive seeds, which are inserted inside the prostate gland. Can prostate cancer be prevented? The risk of this cancer can be avoided by adopting some habits like a healthy diet should include fruits, vegetables, nutrients, and vitamins. Do regular exercise. It will maintain the overall health and mood of the affected person. Try to exercise regularly, most days of the week. Balance a healthy weight. If the affected person's weight is healthy, try to maintain it with vegetables, fruits, etc. If he is obese, choose a little bit of strenuous exercise, which will keep the weight. Take a plan from the healthcare provider. What are the complications associated with prostate cancer? Prostate cancer, and its treatment as well, can cause some complications, which include incontinence. Urinary incontinence can occur due to treatment of prostate cancer. This condition improves with time, and its cure depends on the cancer stage. Erectile dysfunction. This condition could develop due to surgery or hormone treatment. Erectile dysfunction is cured by a vacuum device, which assists erectile dysfunction. If you enjoyed this video, don't forget to like, share, and subscribe to our channel for more captivating content. And as always, stay curious and keep exploring.